Hey, hello. Welcome to Chai with Cheruba. Happy Thursday. Um, I woke up really early today and I already had my coffee. So my chai today is some water. Um, so wherever you are in the world, grab your cup of chai. Maybe it's decaf, depending on where you are, and let's do some Q&A. Um, And yeah, I would love to see where you guys are, watching from, listening from. Say hi in the chat and happy end of summer, I guess, in the United States, in the Western part of the world. Um, I am so excited to just answer questions today. I've gotten a lot of feedback on my recent videos that people found it really useful, especially my pre-op and post-op videos that I posted on YouTube. So if you haven't watched those videos, please check those out. It will be super, super useful. And all right, let's dive in with some questions. Okay, let's see. Do we have anything? All right. Okay. It's been 9 months since I gave birth, and I still don't feel connected to my body physically or emotionally. Is that normal? Um, the recovery period for postpartum is so different for every woman. For some people, bounce back right away, and for others, it takes a while. 9 months is quite a bit, and so if you're still kind of not feeling, I wouldn't say back to normal because there's really no normal after giving birth to children. It's a new normal. So there's no back to normal, but if you're really not feeling connected, I would seek help. I would talk to an OBGYN, maybe see a therapist, a coach, and do the things that usually work for you: meditation, movement. But at the 9 month mark, if you're still not feeling connected, there could be more going on, and you want to get that checked out because having a baby and that whole postpartum life is a whole different ballgame, and something that can shock many people and their bodies as well. So seek the care that you need. Okay, what else? I've tried 3 different birth control pills and all of them have made me feel off. What are my other options? So it really depends what you're going after and why you're on birth control pills. Is it because you truly need birth control, or is it because you need you have heavy bleeding, or maybe you have other hormonal fluctuations that you want to even out? So it really depends what your goal is. But yes, we've got many other things. We've got the patch, we've got we've got 2 vaginal rings, we've got the IUDs, we've got an Explanon, which is a insert in the arm. So there's many options of things, other than your standard birth control pill. So definitely speak to your GYN about it. I'm only 48, but I'm getting hot flashes and night sweats. Is that menopause or something else? It's probably menopause or perimenopause. So you may still be getting your period, but you may start to feel some of the symptoms of perimenopause around this time. So definitely check that out. See a doctor, get some hormones checked, and maybe get on some hormone therapy to make yourself feel better. Okay. Any other questions? These are good. I've been dealing with pelvic pain for years, but no doctor can tell me what it is. Should I be asking about endometriosis? Absolutely. Even before I read the second part of your question, I already started thinking endometriosis. Endometriosis is super common. Just yesterday, I was operating on somebody for fibroids, so completely different, thing, but she had endometriosis. On Monday, I did 2 surgeries. I was doing I was doing a couple of hysterectomies again for fibroids, but lo and behold, I saw endometriosis. So endometriosis is very, very common. Can cause a lot of pelvic pain. You should be seeing GYN regarding that. There are medications for it, as well as surgical options. So definitely look into that and dive into that to feel better. I'm in my 30s and my sex drive is practically non-existent. Is there something wrong with my hormones? Um, there could be, and every person is on a continuum of, when we think about sex drive and libido, it's different for everybody. It's certainly not like it's portrayed in the movies. And if you go out with your friends, I mean, if you go out with five people, all five could have different levels of interest and drive. And so um, I would say you should definitely get your hormones checked, and also look for other medical causes. So not just your hormones, but other things that could be going on, including diabetes and other vascular disease and thyroid, and just other hormonal things and metabolic things that could also be affecting it. So you want a comprehensive workup, and so definitely see your doctor about it. And there are medications to help with this. So don't lose hope. All right. Any other questions? I've been feeling so bloated and heavy lately, especially during my period. Could fibroids be the issue? Certainly, fibroids can be the issue. You could have endometriosis. You could have adenomyosis, where this is where endometriosis grows into the wall of the uterus and can cause, this feeling of heaviness. People will say that they almost feel like the uterus is like sagging down during their period and then kind of raising up uh, a little bit right after. So it can also cause heavy bleeding. So adenomyosis is top on the list. It's something that you could get an MRI for to check it out. Um, so yeah, and if it's fibroids, a quick ultrasound will be able to tell you if it's a fibroid too. So make sure you take a look. Anything else? Okay. I've been told that my pelvic floor is too tight, but I didn't even know that was a thing. What does that mean and what can I do about it? Yes. So, pelvic floor dysfunction is a whole phenomenon that is being discussed more and more. And I know when I was in medical school, that was, not, I mean, I don't remember learning anything about it. And even in residency, I think we touched on pelvic floor therapy, but that wasn't, such a hot topic. But certainly now more and more people are aware. And when your pelvic floor is too tight, it could mean that just the muscles that make up the pelvic floor, the cradle of the pelvic floor, can be extremely spasming and tight. For some people it's the opposite, it's very loosey goosey and lax, which can cause issues. But when your pelvic floor is too tight, it can cause things like painful sex, even painful periods. It can cause just right pelvic pain, baseline pelvic pain. It can cause things like even urinary incontinence. If your pelvic floor is too loose, it can cause things like prolapse and incontinence. Incontinence can actually be, a little bit both ways. So essentially, it's causing pelvic floor issues, bladder issues, urinary issues. So if you are completely asymptomatic though, like as in you don't have any symptoms and this was somebody just told you this on a routine exam, you don't really need to do anything about it. But if obviously my feeling is that you probably saw a pelvic floor therapist who told you that it was too tight, then your treatment will depend on what the issue that you're dealing with is. So yes, what can you do about it? There are different exercises, breathing techniques, that a pelvic floor therapist can go over. So I would definitely pay attention to that. Okay, what else? Any other questions? I get a burning sensation when I urinate. I went to my OB and she gave me some meds. It still didn't go away. Now there's blood when I pee. What could be causing this? Um, yeah, there are many reasons why this could be happening. Um, it really depends on how old you are and what's going on. So I really can't give you too much information here, but certainly it can be a UTI, which is the most common factor here. So I would definitely send your urine for a culture, see what bacteria is growing, and get treated appropriately for that. And again, the differential is wide and it really depends on how old you are. Hi, Kat. Okay. Um, I've been on the pill for years, but I don't want to stay on it long term. What are my options for contraception now? Again, it depends on how old you are and what your goals are. So whether it's to kind of control your periods or if it's to, really be on birth control. We've got IUDs, which are great options, hormonal and non-hormonal. We have a little implant that goes in your arm. We've got a patch. We've got a couple of vaginal rings. So there's lots of options. Definitely see your gynecologist about that. I've had a miscarriage and I'm terrified to try again. How can I increase my chances of a healthy pregnancy next time? So I want you guys to know that miscarriages are very, very common. About 20 to 25% of all pregnancies end up in a miscarriage, although it's not very talked about. It's super, super common. So I can totally understand why you may be terrified to try again. But know that a lot of times, actually almost always there's nothing you could have done to cause a miscarriage. They are really common, and the most common reason is because genetically, the chromosomes that matched up to make that embryo and the baby just were not genetically normal, and so this was just the body's way of ending that pregnancy. That's the most common cause. So I always suggest eating well, eating healthy, exercising, getting enough sleep, just maintaining a good, healthy lifestyle as the best thing you can do. If you keep getting recurrent miscarriages, so 2, 3 miscarriages, then I would, seek a full workup and make sure there's nothing genetic going on with you or your partner, or other clotting disorders or other things. But if it was just one miscarriage, as painful as that is, I think you should, have a healthy lifestyle and keep trying. How do I get a UTI? Will I get it from my partner? I hydrate a lot. UTIs most frequently are common after intercourse, because there is bacteria in the vagina that is being pushed up, and picked up by the urethra that can then cause an UTI. So it again depends on how old you are, but if you're perimenopausal, menopausal, it could be also that you have a lack of estrogen on the vulva, and the bladder, and this makes you more susceptible, to get UTIs. So there's that. And I would definitely make sure you're keeping clean, and peeing after sex. And those are kind of the common things that you can do. But yeah, and if you're postmenopausal or perimenopausal, vaginal estrogen can also help. I've been told my hormones are off, but no one has really explained what that means. What should I be asking to understand my hormone levels? Good question. I think many, many women are concerned about this. Like, what's going on with my hormones? Are they normal? Are they off? What's happening? So I think, again, it really depends on how old you are, whether you're in your 20s, 30s, 40s, 50s, and what kind of hormones are we talking about? There is no magic number for hormones because depending on where you are in your cycle, it can fluctuate rapidly and, all over the place, depending on which week, which day you are. So I would, find out, I would relate this to your symptoms. So if you're having irregular periods, if you're having hot flushes, if you're having sweats, I would really come back to exactly that and find out which hormones are responsible for those, and then look at those levels. You may also want to see an endocrinologist, who is a hormone doctor, and rather than just a general doctor. So that would be my next step, to really do a deep dive into what's happening. I was diagnosed with PCOS and have acne that never goes away. What can I do to clear up my skin while managing my PCOS? So there are certain types of birth control medications that really help with acne. If you see a dermatologist, there are other medications they may give you. So certainly, I think topicals can help, but also oral medications can help. So I would speak to your physician about that. These are really good questions. Okay. A lot of UTI questions today. I've taken antibiotics for my UTI, but it keeps coming back. What else can I do to prevent this? So, again, for UTIs, it depends on how old you are. But let me go right to perimenopause and menopause. For those who are getting UTIs mid to late 40s, 50s over and over again, you just need to be on vaginal estrogen. Vaginal estrogen is safe. It's estrogenizes the vulva, the vagina, the bladder, and it's really a great option for those who are getting recurrent UTIs. You will see a big difference. If you're in your 20s and 30s, there may be other things going on that need to be worked up, but I'll just talk about vaginal estrogen right there. I've been on the pill for years, but I don't want to stay on it long term. Okay, so I think we addressed this question before about being on the pill for a long time. Again, it depends on how old you are, as to what kinds of next options you have. But there are lots of options in the market: IUDs, Nexplanon, rings, patches. So it really depends on your lifestyle and what your goals are. So I would speak to your doctor about it. Okay, yep, we addressed this one too about fibroids. This can definitely be the case. I would get a pelvic ultrasound to make sure that you're not suffering from fibroids. Any other questions? Okay. My partner says I might be getting UTIs because of sexual activity. Is there any truth to this? I'm in my 20s. Yes, you could be getting UTIs because of sexual activity. Make sure you pee right after, having sex. This really helps making sure both of you are clean before, and just maybe wiping after, making sure you're hydrated. If this keeps happening, you may be somebody who needs to take a small dose of an antibiotic every time you have sex. But make sure you're doing the basic things first. I get cramps every month, but they're not unbearable. Should I be doing something about them, or is it just normal period pain? So it is normal for women to get cramps during periods. Sometimes the first 2 days can be pretty bad. It is not unheard of to take a Motrin or an Advil to help with cramping pain. The way you know that it is not normal is if it's so bad that you're having to, stay at home from school, from work, and just, not be able to do the things that you usually do. If you can't exercise, if you can't do the basic things that you do, that's a problem, and you should definitely seek help. But some cramping that you take a Motrin for is normal. I've been diagnosed with endometriosis and I'm afraid of the long-term effects. What should I know about managing it effectively? Okay, so this can be a whole talk by itself. So endometriosis is a long term GYN condition. It's not something that, okay, you take a pill for, or you do a surgery and it disappears. This sort of has to be managed with lifestyle, diet, exercise, sleep, kind of keeping your immune system healthy. You may need some medications. You may need surgery. The biggest thing I would say with endometriosis is keep your fertility in front of you. And what I mean by that is if you are trying to get pregnant, or that, down the line you want to get pregnant, this is the time to see a fertility doctor. Maybe, get some embryos going, maybe freeze your eggs. Again, depending on your age and everything like that. But I just want you to keep that in mind. A lot of times in my office, I see patients, late 30s, early 40s, bad endometriosis, and they haven't thought about any of this. And now it's a little too late to even try and get pregnant on your own. So that is the biggest precaution that I would give is just don't think, oh, it's just about pain, but it can also affect fertility. And you want to be thinking about that. If you're somebody who doesn't care about fertility, then you don't need to think about it, but you just need to manage your pain and other symptoms. But yes, frequent yearly check-ins with your gynecologist, getting regular scans, all of this is important. I found a lump on my breast and I'm freaking out. What should I do next? Okay. So, yes, clearly this can be very anxiety provoking, especially if you have a family history of breast cancer. I will say most lumps are benign. There are, depending on where you are, there may be a cash pay ultrasound option that you can, go and get done just to ease your mind and calm your nerves. If you're in the San Francisco Bay Area, there is one called My Eve Wellness in the city. But yes, I think calling and seeing if you can get in a little bit sooner will help, just for some reassurance. Sometimes your doctor may order a mammogram or an ultrasound to double check that. Okay, we have a few more minutes. I'm in my 40s. I'm thinking about getting my tubes tied. Is there anything I should consider before making this decision? So good question. By tubes tied, I think you mean your tubes removed, because we don't really tie tubes anymore. Excuse me, we take them out completely, because the risk of ovarian cancer goes down when you remove your fallopian tubes, because some types of ovarian cancer actually start in the fallopian tubes. So you definitely want to get your tubes removed, not just tied. And you just want to make sure you absolutely don't want to have any more kids on your own, before you make that decision. And, there is, some people will say, oh, when I removed my tubes, I kind of felt, a few hot flashes, for a couple weeks. That may happen just because the blood supply to the uterus, the ovaries, the fallopian tubes are all shared. So I would, just, think about that, and not be surprised if that happens. But yeah, these are the things that I would consider. Okay. I've been feeling really down after my baby was born. My doctor says it's just baby blues. How do I know if it's actually postpartum depression? Okay, good question. There are questionnaires that you can actually take to see if it's postpartum depression. And blues should kind of go away after about 6 to 8 weeks. So, there's a lot of adjusting and all of that right after you have a baby, right? It's a big, big life change. Um, and so feeling a little blue and just out of it is normal. But if that continues, 2, 3 months after giving birth, then you definitely want to seek help and you want to see what's going on, and also, potentially get some treatment. We'll take a couple more questions. Thanks, Kat. Yeah. All right. Anything else? Any other questions that are coming up? We have 1 or 2 minutes. Would love to take those. These are really, really good questions. Please tag this. Please tag a friend who could, use this information. This will go up on our YouTube, and yes, please share this, with friends or colleagues who can use this information. Feely says, I want you to be my doctor. Yay. If you're in California, I could be your doctor. So if you guys, are in California, I'm in the Bay Area. So happy to see you as a patient, or if you're anywhere in California, we could still do a video visit, virtual visit. Happy to see you as a patient. If you are anywhere in the world or a country, outside California, we can always set up a coaching call with you to discuss any issues you have. So please reach out to our office. There's our website right there. And I will see you guys in the next episode of Chai with Cheruba. Thank you so much. And make sure you are subscribed to my YouTube channel, because I put new videos out there every Monday and you definitely don't want to miss those. Okay, guys, take care. Bye.